Hello everyone, Dr. Monica here. Welcome back to the channel. Today we are going to talk about a very important topic in dental anatomy, that is the differences between the permanent maxillary and mandibular canine. So let's begin. Let's first talk about few unique features about canine. It is the longest tooth in the dental arch and plays a crucial role as a cornerstone of the mouth. The term canine derives its resemblance to the prehensile teeth of carnivorous animals. Canine also aids in the tearing of food. With self-cleansing properties and strong anchorage in the jaw, it is also the last tooth to shed in the dental arch. Canine contributes to both functional stability and aesthetic in the dental structure. First, let's talk about few roles of canine in the dental arch. Canine play a vital role in supporting the mesially present incisors and distally present premolars, ensuring proper dental alignment. Talking about the canine guidance, it helps to direct bite during lateral jaw movements. Canine eminence, the bony ridge above the canine, enhances their stability in the mouth. Canines are also designed to tear or crush food with their sharp pointed cusp. Its unique shape promotes self-cleaning during chewing. Let's start by discussing the general differences between maxillary and mandibular canines. Both maxillary and mandibular canines show the first evidence of calcification around 4 to 5 months of fetal development, with crown formation completing by 6 to 7 years. The maxillary canine typically erupts between 11 and 12 years, while the mandibular canine erupts a bit earlier, that is around 9 to 10 years of age. When it comes to completion, the maxillary canine finishes around 13 to 15 years, whereas the mandibular canine completes its root development slightly earlier, that is between 12 to 14 years of age. The maxillary canine is about 1 mm wider labialingually than the central incisor, but 1 mm narrower mesodistally than the central incisor. In comparison to maxillary canine, mandibular canine is generally narrower in both dimensions, that is labialingually as well as mesodistally. Cingulum, which is present in the lingual aspect, is more prominent in the maxillary canine than in the mandibular canine. Additionally, the maxillary canine has a single root, while we can sometimes see bifurcated root in the mandibular canine. Let's begin by exploring the labial aspect of the canine teeth. Starting with the maxillary canine, it typically has a trapezoidal or pentagonal shape when viewed from the labial side. This shape is characterized by a broader base, giving the maxillary canine a more prominent and a robust appearance. In contrast to this, the mandibular canine has more of a pentagonal shape. Coming to the crown, the maxillary canine it is narrower than the central incisor, whereas the mandibular canine it is narrower and slimmer compared to the maxillary counterpart, giving it a longer appearance. In the maxillary canine, the mesial contact area is typically located at the center of the middle third of the crown. In contrast, in the mandibular canine, the mesial contact area is positioned higher at the incisal third of the crown. In the maxillary canine, the distal contact area is located at the center of the middle third of the crown. On the other hand, in the mandibular canine, the distal contact area is positioned at the junction of the middle and the incisal third of the crown. In the maxillary canine, the cervical line it is convex labially with convexity towards the root portion, whereas in the mandibular canine, the cervical line shows a semicircular curvature apically. Next, we come to the mesial outline. In the maxillary canine, the crown is convex from cervix to the center of the mesial contact area, whereas in the mandibular canine, it is nearly straight with that of the root. Coming to the distal outline, in the maxillary canine, the distal outline shows a concavity between the cervical line and the distal contact area, whereas in the mandibular canine, it is slightly rounded as we can see in the diagram. Coming to the labial surface, the maxillary canine shows no developmental lines and it is smooth, whereas in the mandibular canine it is more smoother and flatter as compared to the maxillary canine. Coming to the cusp tip, in the maxillary canine, the cusp tip is on a line with the center of the root, or it might be slightly present labially, but in the mandibular canine, it is more lingually inclined. Coming to cusp height, the cusp height in the maxillary canine, we can see it is one third the crown length, whereas in the mandibular canine, the cusp height is approximately one fifth the crown length. Next we have is cusp slopes. Maxillary canine shows shorter mesial slope and longer slope distal slope. Whereas in the mandibular canine we can see mesial slope is short but straight and the distal slope it is longer and more curved. Talking about the labial lobes, both maxillary and the mandibular canines have three labial lobes, that is the distal, middle and the mesial lobes. But in the maxillary canine, the middle lobe shows greater development which produces a ridge on the labial surface of the crown, whereas in the mandibular canine, the middle lobe is less prominent. Coming to the root shape, the maxillary canine, the root shape is conical with bluntly pointed apex, whereas in the mandibular canine, the root is conical in shape with pointed apex. The root surface in the maxillary canine is smooth and convex at all points, and root surface of the mandibular canine is convex. Now let's explore the lingual aspect of the maxillary and mandibular canine. Coming to the crown, in the maxillary canine and the mandibular canine, they are both narrower lingually as compared to the labial aspect. Coming to the cervical line, the maxillary canine shows more even curvature in the cervical area, whereas in the mandibular canine, they more curvature towards the root apex with slight distal offset is seen. Talking about the cingulum, the maxillary canine presents with large and well-developed cingulum, whereas the mandibular canine presents with smooth and poorly developed cingulum. Talking about the marginal ridge, maxillary canine shows well-developed ridge confluent with the cusp tip, whereas it is less distinct in the mandibular canine. The mesial and the distal lingual fossa, it is deeper and well demarcated in the maxillary canine, whereas it is shallow and not well demarcated in the mandibular canine. Coming to the root, both maxillary and mandibular canine, the root is narrower lingually as compared to the labial surface. The lingual ridge of the root, it is narrower, smooth and convex in the maxillary canine, whereas it is smooth and regular in case of mandibular canine. Now let's talk about the mesial aspect differences between the maxillary and mandibular canine. Coming to the cusp, in the maxillary canine, the cusp is slightly labial to the midline, whereas in the mandibular canine, the cusp is slightly lingual to the midline. Labial outline in the maxillary canine. More convexity from the cervical line to the cusp tip than the maxillary center incisor is seen in the maxillary canine, whereas less convexity from the cervical line, which is more straighter, is seen in the mandibular canine. Coming to the lingual outline of the maxillary canine, convex line describing the cingulum which straighten out as the middle third is reached and becomes convex again at the incisal third, whereas in the mandibular canine it is less convex. The labiolingual width in the incisal third is more in the maxillary canine as compared to the labiolingual width in the incisal third in the mandibular canine. Coming to the cervical line, in the maxillary canine, the cervical line curves towards the cusp with an average of 2.5 mm, whereas in the mandibular canine, the cervical line curves towards the incisal portion. Coming to the root, in the maxillary canine, the root is broad with shallow developmental depressions for part of the root length, whereas in the mandibular canine, we can see developmental depressions on the root which is more pronounced and deep. Now, talking about the distal aspect differences between the maxillary and the mandibular canine, cervical line in the maxillary canine shows less curvature towards the cusp ridge, whereas in the mandibular canine, the cervical line curves more towards the incisal portion. In the maxillary canine, the distal marginal ridge is more curved and thicker, whereas it is less curved and thinner in the mandibular canine. The surface outline in the maxillary canine, it is more concave, usually above the contact area, whereas it is more flat or concave in the mandibular canine. The developmental depression in the maxillary canine, it is more pronounced as compared to the developmental depression in the mandibular canine, which is more shallow. Now talking about the last aspect or difference, that is the incisal aspect. In the maxillary canine, the labiolingual dimension, it is greater than the mesodistal dimension. Similarly, in the mandibular canine, the mesodistal dimension, it is lesser than the labiolingual dimension with less curved mesial surface outline. Coming to the cusp tip, in the maxillary canine, the cusp tip is labial to the center of the crown labiolingually and mesial to the center, whereas in the mandibular canine, the cusp tip is near to the center or lingual to the center. The disto-incisal angle in the maxillary canine, it is more rounded and obtuse, whereas it is less rounded and sharper in the mandibular canine. The distal slope in the maxillary canine, it is longer than the more angled mesial slope, whereas in the mandibular canine, the distal slope is longer than the straighter mesial slope. Please like and subscribe to this channel. Thank you.